Good evening.
My name is Janet Weinberg. I'm the Chief Operating Officer at GMHC, Gay Men's Health Crisis. And thank you for coming together for this gathering. We are in the midst of a historic moment in the epidemic that has come too infrequently. We, if we all work towards changing, can have a major decline in new infections of HIV. Make no mistake about it, it will not come easy. But change is always very, very hard. As we enter the fourth decade of the epidemic, getting to zero new infections is for sure a deeply ambitious goal. Yes, it's a realistic goal. Yes, it can be achieved. And yes, we have the tools today to make that achievement. Community-based organizations such as GMHC must commit to work with doctors, faith-based communities, funders, government agencies, elected officials, and to engage everyone in the dialogue and using the tools that are available today. Yes, right now. What are those tools? Well, we need to have more education. Education includes social marketing. Education includes printed and online tools. Education includes tweeting, Facebook, texting, messages that have positive and affirming messages about safer sex and safer behavior. Non-abstinence-only sex education programs in schools, homes, doctors' offices, and religious settings need to be established. Evidence-based prevention methods such as the use of HIV medication and condoms must be taught. Positive images of all types of love, non-stigma-driven images, words and practices, and very critically, we need to make a continued commitment to removing barriers of homophobia, racism, sexism, and poverty. What are those tools I talk about? More prevention methods. Condoms should be and continue to be a first line of offense. Sex is a wonderful thing as long as it's done responsibly. Test, and test some more. This means encouraging first-time testers to get tested. This means encouraging new testers to retest. This means encouraging experienced testers to never become lax about testing them to find out their HIV status. Today we have a tool called pre-exposure prophylaxis. Some of you know it as PrEP. It's an important tool. We know that people have been trying this out in community for years. We hear stories of what's called MTV, methamphetamine, Truvada, and Viagra cocktails. This is not new. This is only now becoming scientifically proven that if PrEP is used responsibly, it is effective. Data on PrEP is extremely optimistic at this point. There were 5,000 people who entered a study called IPREX. 2,200 of those 5,000 were completely faithful to the study and stayed compliant to the study. They went to the doctor every 3 months. They got their bloods tested. They complied with taking their medication. They followed their regime exactly. The result? Close to 100% of those folks stayed negative during this study. But how do we sort out who can be compliant to this difficult regime and who will have difficulty with it? Who's a good candidate for PrEP is the question, not whether PrEP should be included as a tool. We need more treatment. Antiretroviral therapy is available and it's effective. Yet the question remains, how do we get the numbers up from 45% of people continuously taking care to 100% of people in continuous care? This is how antiretroviral therapy can eliminate HIV disease. How do we get more than 28% of the people on ART to get their viral loads down to a number that truly helps eliminate new cases of HIV. Yes, if somebody takes their antiretroviral therapy regularly and is a good candidate, they can have a zero-suppressed viral load so low that it's undetectable to find HIV in their system. But how do we get the 72% of the people who are on ART to that level? Did we ever think that pharmacies could change? Well, normally pharmacies compete against each other. Yet Gilead and Bristol-Myers Squibb came together to create a single pill to help people be more compliant with medication. Yep, change really can happen. If 2 pharmacies can do this, so can community-based organizations, medical facilities, churches, CBOs, and schools. We can and we know how to lower a community viral load. Let us not forget how effective this is as a tool. Testing and treating all those infected with HIV, neighborhood by neighborhood, is the essential trick here. Much of what we can do to promote the tools is dependent on each of us in taking responsibility. That's hard. Again, change is hard. It will take medical providers working hand in hand with service providers to work on education, compliance, and stabilizing disparity. It will take researchers and scientists to continue to develop new and easier methods to prevent and treat HIV disease. It will take funders and donors to continue to commit providing resources. It will take government officials to continue to implement coordinated strategies to resolve current and emerging issues. It will take faith-based communities to protect their followers with non-abstinence-only messaging. We have made a lot of progress together in the last 30 years. It's not been easy. It's not been without controversy. But let's not stop now. Let's keep focused on the future, and let's get this number to 0. We can do it. Thank you.